we are going to discuss about the female folks, regardless of your age, in today's Ever Healthy Multidynamic International Health Seminar. Today is about the female folks. It's about women. It's about ladies of various ages, varied ages and categories, whether single or married, whether you are a widow, whether you've entered your menopause, whether you're still seeing your menstrual period. Today's discourse, which has to do with fibroid, will highly benefit you. Even as a man, you have a wife, you are also going to benefit from it so that you can compliment your wife by assisting her to see what she'll be doing to know her fibroid status as a woman. That having been said, ladies and gentlemen, today we are going to learn what fibroid is all about. We're also going to find out what causes women to have inflammation or health issues of the fibroid. Because let the truth be told, every woman has fibroid. Every lady has fibroid. You're created with it. It's part and parcel of your gynecological system. You can't do without it. So we're going to find out, why has it become a nightmare to the female folks, this fibroid we're talking about? And we're going to also discuss the risks that fibroid presents for the female folks and diagnosis that women need to do to ascertain their fibroid status from time to time, and what they should also do in terms of lifestyle, to what they should avoid to eat, so that they should not be the ones, because of lifestyle, be the ones to serve as a catalyst. Let their lifestyle serve as a catalyst to speed up the inflammation of their fibroids. All this being put together is what we are going to learn today. So once again, I say welcome. On the screen, you can see it's being shared. Women health. Fibroid. Yes, you can see it on the screen. Fibroid. All right. So the first, what are fibroids? Like I said earlier, regardless of your age, every woman is created with fibroid. Every woman has fibroid. You understand? It's just like appendix. Every man and woman has appendix. But today, we're discussing about the female folks. You understand? So in a similar vein, every woman has fibroid. If you're saying that you don't want to have fibroid, you're saying that what makes you to be a woman, your gynecological system should be evacuated. All right? So everyone has it. So now we want to learn, we want to know, what is fibroid? Uterine fibroid. What is fibroid? Fibroids are tumors made of smooth muscle cells and fibrous connective tissues that develop in the uterus. That is what fibroid is. Let me reiterate. Fibroids are tumors made of smooth muscle cells and fibrous connective tissues, meaning two things makes up the fibroid in a woman. One is smooth muscle cells and fibrous connective tissues that develop in the uterus. The uterus is the womb. If you don't want to use the medical term uterus, you use the layman's language. Womb, that is where the fibroid is. Okay? It is estimated that 70 to 80% of women will develop fibroid in their lifetime. You can imagine. You see why it's imperative that all the female folks should give attention to this topic today. Because here says that 70 to 80% of women will develop fibroid in their lifetime. As long as you're a woman, 70 to 80% women in this planet Earth will develop fibroid in their lifetime, as long as they are alive. All right? However, not every woman will develop symptoms or will require treatment. Yes. How do I mean? What I'm saying in effect is that not every woman will have the symptom or will have the sign and symptom that she is having fibroid issue. No, not all women. Or better still, not all women will require treatment. I'm going to explain that as we go down this health discourse. The most important characteristics of fibroid is that they are almost benign or non-cancerous. Remember, when we say benign, these are non-cancerous tumors. But when we say malignant, we're talking about cancerous tumors, meaning the fibroids that women has or that occur in them are what we call benign tumors. They are non-cancerous tumors. However, at the early instance, the tumor, which has to do with the fibroid, may seem to be cancerous. But after diagnosis, it has been proven medically, medical sciences, that women naturally do have benign, non-cancerous fibroid, not the cancerous one, which is the malignant. No, it is just benign all through. All right? Cancerous fibroids are very rare. Because of this fact, it's reasonable for women without symptoms to opt for observation rather than treatment. Studies show that fibroids grow at different rates. Even when a woman has more than one, they can range from the size of a pea to the size of a watermelon. You can imagine the sizes of these fibroids can range from the size of a pear. You know a pear? A pear is smaller than the size of a lemon. That is water lemon. You know how big water lemon is? You know the size of a pear. I mean, you can't compare the two. The difference is clear. The watermelon is bigger, far bigger than the size of a pear. So these are the ranges, the different sizes of fibroid that develop in women, ranging from the sizes of a pear to the sizes of growing to the point of becoming the size of a watermelon. That is how it inflames. That is how it develops in a woman in all their uterus, which is the womb. Even if fibroids grow that large, we as Ever Healthy Multidynamic International offer timely and effective curative Ayurvedic medicines to provide relief. Remember, history have shown medically that as long as the orthodox or conventional doctors are concerned, when these fibroids grow to that size of a pear, to the size of a watermelon, in fact, even at the size of a pear, their best medical option, they will tell you as a lady or as a woman, single or married, is surgery, surgery, surgery. Today, we're going to learn to see that surgery is not the final bus stop all the way out. If you're having issues with fibroid as a woman, no. Dr. Britishman, is one of the doctors in Lagos, Nigeria, Africa, that don't subscribe to fibroid surgery when a woman has fibroid. You know why? The reason is because as long in Ever Healthy Multidynamic International, that these on Indian Ayurvedic curative medicines, second to none, we have what it takes for such a woman that has fibroid, even to the size of watermelon, not to go for surgery, as long as you're going to stick to the medical directives given to you by Dr. British Man. That having been said, in addition to understanding what fibroid is, here are some key points about uterine fibroid you should be aware of as a woman. 1. Uterine fibroids are the most common tumor of the reproductive tract. Take note of that. Uterine fibroids are the most common tumor of the reproductive tract. Remember I said earlier, these tumors are benign. They are non-cancerous. So there have been nothing to put fear into. You shouldn't be afraid. They are non-cancerous, benign tumors. All right. Number 2, women who are nearing menopause are at the greatest risk for fibroids. You get it? The key points of uterine fibroid. Women who are nearing menopause. You know, before now, I have told you all, ladies and gentlemen in this audience, that you see, change, they say, is something constant, something inevitable, something dynamic. Yes. Here it's telling us that women who are nearing menopause are at the greatest risk for fibroid. Before now, many years back, For a woman to be in her menopause starts from age 55, plus minus, all things being equal health-wise. Age 55, but come to think of it, change, like I said, is dynamic, is constant, is stable. What is happening now, don't be surprised that as we speak now, there are most ladies, even in their late 40s, in their late 30s, they are already experiencing menopause. I, Dr. Britishman, have handled cases of such nature medically. Yes, you begin to wonder what is the problem. A woman at late 30s, late 40s is already in her menopause. You see, so that is why here, this 2-second key point said, women who are nearing menopause are at the greatest risk for fibroids. Greatest risk. So begin to use your tongue to count your teeth as a woman, as a lady. How old are you? Are you nearing menopause? You must be health cautious if you're nearing menopause, because women who are nearing menopause are at the greatest risk of having fibroids. Number 3, fibroids are most often found during a routine pelvic abdominal exam by your health care provider. How do I mean? Fibroids are the most often found during a routine pelvic abdominal exam by your healthcare provider. Yeah, as a woman, possibly, maybe you're beginning to have the signs and symptoms that maybe your fibroids have inflamed, or maybe they've grown beyond the normal size, or maybe they've even multiplied. And possibly you go and see your healthcare provider in the laboratory. What your healthcare provider will do is to put on hand gloves, put on face masks, ask you to lie down, open your stomach, uses his hand to begin to feel both your upper and lower abdomen. From that examination, physical examination, this healthcare provider will ascertain, will know, oh, you actually have fibroid, or your fibroid has multiplied, or your fibroid, better still, has inflamed, it has enlarged. I also do such physical exam as a healthcare provider. Okay, which is the third point. Then 4, symptoms may include heavy and prolonged periods, bleeding between period, and pelvic pain. Ask yourself, as a woman, as a lady, single or married, are you still seeing your monthly menstrual period? When you have your monthly period, menstrual period, do you have heavy bleeding? Does the period prolong, monthly period prolong more than 4 to 5 days? Does it extend beyond 4 to 5 days? Or does your period prolong to the point of 1 week, 2 weeks? Because I've handled cases whereby this woman, as a client and patient sitting before Dr. Britishman, is telling me that my periods have been there for the past 2 weeks with massive bleeding, prolonged bleeding. It does happen. Yeah, so symptoms may include heavy and prolonged period, bleeding between periods, and pelvic pain. You know, women cycle every 28 days. But when we say between periods, you may see your period within these 2 weeks. In another 2 weeks, you're also seeing your period again. There's a problem. There's a health issue. There's a health challenge. There's underlying health issue for you as a woman you're not aware of. Number 5, there are a variety of treatment options available. So all these 5 key points are what you should know. Take to heart as a woman, as a lady, single or married, regardless of your age. Now, I want to discuss the types of fibroids that are evident in women that do occur as a health issue for the female folks. It is good for we to know the types of fibroid that do occur in the female folks. Now that you know what a fibroid is, it's time to discuss types of fibroids. Along with the size and number of fibroids, the type can also affect if affect treatment recommendations. The three main types of fibroids include, number one, subserosal fibroids. Subserosal fibroids is number one fibroid in women. These are the most common fibroids. They can push outside of the uterus. That is, these fibroids will grow outside your womb into the pelvis. Subserosal fibroids can grow large at times and sometimes have a stalk that attaches to the uterus called pedunculated fibroid. A stalk like a ureter. You know, a ureter is like a pipe that connects the kidneys to the bladder. That is how this fibroid grows. It stalks. Remember, outside your womb, outside your uterus, not inside. Take note. Subserosal fibroid grows outside your uterus, outside your womb. Okay? But however, it grows large to the point that it now has stalks to attach to your pelvis. Take note of that. That is subserosal fibroids. Number two, intramural fibroids. Intramural fibroids, which is another type of fibroid. These fibroids develop in the muscular wall of the uterus. In the muscular wall, it is shown in the on the scene there. The muscular wall of the uterus meaning inside the wall of the womb. That is where these intramural fibroids grow. You see that it's not the same thing with subserosal fibroids. Subserosal grows outside, while intramural grows in the wall of the womb or uterus. Now the third one, submucosal fibroids. Submucosal. The first is subserosal. This one, the third one is submucosal fibroids. The second is intramural fibroid. The third is submucosal fibroid. These fibroids are uncommon. They can grow into the open space inside the uterus and may also include a stalk, meaning any space they see in the womb, in your uterus as a woman, they can grow there. Any space at all with a stalk, like a ureter, like I said. A ureter is that pipe connecting the two kidneys to the bladder. That is that stalk. Because it can't grow without clicking to something in your womb. It's not possible. So these are the three major fibroids that are core in the female folks, regardless of their age, regardless of their status, whether single or married. Okay? Yes, it happens. It happens from time to time. Women, the female folks do experience this kind of fibroids from time to time. Now, having known the three types of fibroids, we want to discuss what actually causes fibroids in the female folks. Why is it that you as a woman, you as a lady, single or married, do have fibroid health issue? The cause of uterine fibroid is not known medically, although medical studies demonstrate there may be a genetic component or factor. Medically, in medical sciences all over the world, medical scientists have not been able to ascertain what actually causes uterine fibroids in the female folks. However, studies have shown that it's one of the major causes has to do with genetic component or factor. How do I mean genetic factor? When we talk about genetics, genes, DNA, it simply means that as a woman, there's every possibility. What made it possible for you to have fibroid-related health issue is because in your family lineage, your mother, your grandmother, your great-grandmother, your auntie, whatever, blah, 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 it runs in that family lineage. That is genetic factor. That is what studies have shown, though. Take note of that. There is no definite external exposure that a woman can have that causes her to develop fibroids. Thus, no external exposure of any sort can cause a woman to have fibroids apart from this genetic component or factor. That is what medical studies have proven. So begin to use your tongue to count your teeth as a woman, as a lady, single or married. In your family lineage, are there issues that the women in that family had health issues like fibroids? If the answer is yes, that means possibly in the future too, since the major cause is genetic factor, you may also have it if you don't checkmate it now with EMD, Indian Ayurvedic curative medicines. Who is at risk for uterine fibroids? Various factors can increase the risk of developing fibroids. Number one factor is age. Age as a woman. Fibroids can become more common as women age, especially during their 30s and 40s and up to menopause. Especially during their 30s and 40s and up to menopause. Such women at that age can develop uterine fibroid. After menopause, fibroids are much less likely to form and usually shrink if they are present. Why? You see, at menopause, fibroids are much less likely to form. In fact, such fibroids can easily shrink because such a woman is in her menopause. You know why such a woman at menopause cannot have fibroids, cannot be exposed to having fibroid or have fibroid health issues, or better say the fibroid in her womb or uterus will shrink? You know why? Because the supply of hormones such as estrogen and progesterone hormones have reduced drastically or would reduce drastically at menopause. The level at which you secrete estrogen hormone and progesterone hormone in your 30s and 40s is quite different. As you're aging to the point of you being, as a woman, getting to menopause, estrogen hormone level will drop drastically, including progesterone hormone. They will drop. The secretion will not be as when you were in your 30s, your 20s, 30s, or 40s. No, it's not going to be that way. You'll be secreting it, the secretion of these two hormones will drop drastically. Now, what is simply telling us that is that these two hormones serves as a catalyst in a woman that can also speed up the inflammation of the fibroid in a woman's womb or uterus. That is it, because here it says, because the supply of hormones such as estrogen and progesterone hormones have reduced drastically at menopause. The secretion will reduce drastically. You won't be secreting estrogen and progesterone. We'll also have to take that to heart as a woman. Number two, another factor that can increase the risk of a woman developing fibroid outside age. Number two is family history, which I shed light briefly on that genetic factor. Having a family member with fibroids increases your risk. You see now, if there's a family member, check your lineage that you had, my mother's sister, my auntie, they had fibroid. You're at risk. Having a family member with fibroid increases your risk. If a woman's mother had fibroid, her risk of having them is about 3 times higher than average. You see now, family history. As a woman, single or married, again to check, cross-check your family history. Make phone calls after this EMD health seminar. Find out, mommy, daddy, find out family history. Is there anybody in our family that had fibroid health issues? So that you will see reasons to protect yourself, safeguard yourself. To be forewarned is to be forearmed health-wise. Right? Number 3, ethnic origin. Ethnic origin. Now, in terms of the third factor of the risk of a woman developing fibroid, ethnic origin Here, African American women are more likely to develop fibroids than other ethnicities. African American women are more likely to develop fibroids. That is where ethnic origin comes into play than other women from other ethnicities. Number 4, risk of you developing fibroid as a woman is obesity. Women who are overweight or who BMI are much are at higher risk for fibroid. When we say BMI, body mass index, as a woman, single or married, what is your body mass index? Do you do routine checkup of your body mass index from time to time? Because oftentimes when a woman is obese, for the family, extended family members, it's a sign of good living. Oh, her husband is taking very good care of her. For Dr. Britishman, is a lie. You are sick. You are sick. Obesity is not a sign of good living. For me, it's a sign of bad living. It's a sign that there are underlying health issues that you have as a woman. So forget all those praises. It won't take you nowhere. Obesity is not a sign of good living, for crying out loud. Check your body mass index as a woman from time to time. Very important. Now that you've known that obesity, that women who are obese, who BMI are, they are more at risk. They are more at danger to have fibroids. And come to think of it, what really makes women to become obese? Lifestyle, lifestyle, lifestyle. Charity, they say, begins at home. Here in Lagos, Nigeria, I see women in varied ages. You know, carbonated drinks like Coca-Cola, Pepsi, Fanta, 7-Up, Sprite, and the like. Some women see this carbonated drink, taking it with, there's a bread in Lagos, Nigeria, they call, agege bread. Yeah, agege bread. Agege bread is very popular in Lagos, Nigeria. Yeah, agege bread. You know, you see them eating this agege bread with carbonated soft drinks like Coca-Cola. It could be Coca-Cola, it could be Pepsi. And when they are eating this bread with these soft drinks, for them, I mean, this is dieting, this is good food. Ladies in the building, take note. Sugary foods, beverages, carbonated drinks, even energy drinks serves as catalyst. What is a catalyst? A substance that speeds up chemical reaction. These things I've mentioned serves as a catalyst to speed up the fibroid in your uterus or womb to begin to enlarge, to begin to inflame beyond the normal size. Take note of that. And this bread they consume contains what we call bromate. After this health seminar, you can Google bromate and see the health danger it poses for you to eat such a bread. You see, these are contributing factors of why some women are obese. What other factors that makes women to become obese? Yeah, from time to time, maybe your husband, a loving husband, is coming back from work. You see the wife put a call across to the husband. Oh, darling, honey, sweetie, my king, my odogu, please stop by a tantalizer or any eateries. Buy me this burger, buy me that, buy me this ice cream with different flavors and stuff like that. For you, it's enjoyment. All those things you tell your husband to buy for you, which as a loving husband is going to do, but as you're consuming it, these things contains loads of sugar. And the danger in it is that the sugar in these things are not simple sugar, glucose, no. They are not even secondary sugar, no. They are complex sugar, industrial sugar that causes health hazard to you as a woman, even the male folks too. So when you feel that, oh, ice cream this, burger that, it's an evidence of good living, you're enjoying your life, you're dieting, All those things they serve as catalysts to speed up the inflammation and enlargement of a fibroid in your womb. Take note of that. These are the contributing factors of why most women are obese. So please, as a woman, after this ever-healthy multidynamic international health seminar, go and check your BMI. Find out what your body mass index is. If it's above 70, begin to work on it to trim down. We have what it takes to trim you down as a woman. We have loads of Indian Ayurvedic curative medicines like dynamic slim juice, like EMD green tea, like cardamom tea too, clean detox, Duravine. Use them. You will trim, bring down your BMI, your body mass index. All right? That is it. Then, number 5. What poses another risk or danger for a woman to have fibroid? Lifestyle, which I've shed light on that. I think I've really spoken about this lifestyle. There are some women who consume alcoholic beverages more than the male folks. If you are a woman, your intake or consumption of alcoholic beverages, those alcoholic beverages you're taking, it will serve as a catalyst for your fibroid in your womb to inflame or become enlarged. Take note of that. So be mindful of your lifestyle. You see, from time to time, I tell you all, ladies and gentlemen, that when we begin to advance in age, there are certain foods we need to avoid. Take, for instance, you are a woman, you are age 40. When you're eating, you have loads of red meat in your food. It is bad. Red meat is another proteinous food that serves as catalyst to speed up the inflammation of your fibroid in your womb as a woman. Take note of that. Rather than consuming more of red meat, why not go for fish? It could be fresh fish. It could be dry fish. It could be stock fish. It could be frozen fish. But let it don't be fried fish. Because anything fried also serves as a catalyst to speed up the enlargement or inflammation of a fibroid in your womb. Take note of that. Avoid fried foods. Avoid red meat, much intake of red meat. Avoid much consumption of carbonated drinks. Avoid much consumption of alcoholic beverages. Some even mix. This Gen Z generation, when we talk about Gen Z generation, it has to do with both the male and the female folks. The youth of this Gen Z generation, you see them mix codeine in a beer, mix tramadol. Some take shisha, some take colos, some take ice, some take wonky tail because they want to feel high. They want to show that they've arrived, but they don't know the health hazard these vices they're engaging themselves in is causing them. So as a woman, stay clear. If you're also a woman, you're a chain smoker, you're also liable to at risk for your fibroid in your womb to become enlarged or become inflamed. So what are the symptoms of uterine fibroids? Most women with fibroids will experience no symptoms at all. However, large or numerous fibroids can cause the following symptoms. Number 1, heavy or prolonged periods. Heavy or prolonged period. Like I said earlier, normally, all things being equal health-wise for a woman, for a healthy woman or a healthy lady, single or married, regardless of your age, if you're still experiencing your menstrual monthly period, normally, your monthly menstrual period should flow between 4 to 5 days max. You're done. But unfortunately, if it goes beyond 5 days, know that it's a symptom that you are having an enlarged or numerous fibroids in your womb. Heavy or prolonged period. Number 2, bleeding between periods. I think I've also shed light on that. You see your period this month, within 2 weeks, the bleeding was so massive. In another 2 weeks again, you're also in another period with massive bleeding. That is what we call in between periods. It's wrong. It's not healthy. It shows that your fibroid needs attention. It has inflamed. It has enlarged. Number 3, Pelvic pain and pressure. Are you, as a woman, lady, are you having pelvic pain and pressure? Symptom and sign of enlargement of the fibroid. Number 4, frequent urination. Before now, when we discuss the topic diabetes, we say one of the signs and symptoms of diabetes, be it type 1 or type 2, is frequent urination. This evening, we are learning that one of the symptoms of a woman whose fibroid has enlarged is what? Frequent urination. So, if as a woman you're having frequent urination, you go and do your HbA1c test or fasting sugar test, blood sugar test, or random fast blood sugar test, and you discover that your blood sugar level is okay, it's good, it's normal, and you are having frequent urination, it is fibroid. Number 5, low back pain. As a woman, as a lady, single or married, are you experiencing low back pain from time to time? Regardless of the nature of your job or what you do for a living? Is that lower back pain constant? Has it become a habitual thing? Because oftentimes when one is having lower back pain, medically we say, oh, go and do kidney function test. Because when the uric acid in the kidneys are high or creatinine are high, the resultant effect is lower back pain. You know why? Because our 2 kidneys is lying adjacent to the spine. So when uric acid is high, creatinine is high, the first point of hit is the spine. You begin to have that lower back pain. But this night, we've seen that outside that, a woman whose fibroid has enlarged will have lower back pain. So if you do carry out kidney function test and your kidney function test is normal, uric acid is normal, creatinine is normal, urea nitrogen is normal, then know that your fibroid has enlarged, which is another symptom of a woman having an enlarged fibroid. Number 6, pain during sexual intercourse. As a legally married woman, when your husband is paying his marital due to you, your legally married husband is paying his marital due to you, in terms of sex, what is in harmony with God's will? Do you have pain? Do you experience pain during sex? Do you have either lower or upper abdominal pain? Do you experience this pain and discomfort while having sex with your husband? Go check your fibroid status. It means it has enlarged. Yes, pain during intercourse. Number 7, difficulty getting pregnant. Yeah, another symptom. Medically, doctors will tell you that if you have fibroid, your chances of conceiving, your chances of taking in is 50-50. That is what every doctor will tell you. So, which makes it difficult for you getting pregnant after marriage. Are you married for 2 years, 3 years, 5 years, 6 years, 7 years, 10 years? The fruit of the womb is not forthcoming and your husband medically is okay? Go confirm the status of your fibroid. Difficulty getting pregnant. You have an enlarged fibroid as a woman, you're married, and the fruit of the womb is not forthcoming for several years. There is an underlying health issue. All right, so difficulty getting pregnant is also another symptom or sign that your fibroid has enlarged or it has inflamed. It has grown beyond the normal size. So these are the 7 major signs and symptoms that will be evident in a woman, in a lady, single or married, for you to know that your fibroid needs medical attention. How are uterine fibroids diagnosed? Another important thing we should take note of. How are they diagnosed? We've been talking about fibroid. Now we're talking about the diagnosis to be carried out for you to ascertain. Because this diagnosis will tell you as a woman the type of fibroid you have. We've mentioned 3. This will be proven through this diagnosis. Out of these three, the diagnosis will show which one you have. So what diagnosis should a woman carry out from a healthcare provider? Fibroids are most often found during a physical exam by a healthcare provider. Your health care provider may feel a firm, irregular, often painless lump during an abdominal or pelvic examination. Yes, it does happen. Scans can confirm a diagnosis. These tests are the two main options. Number one, ultrasound. From time to time, when there is any issue with infertility in a woman, what Dr. Britishman do recommend is pelvic abdominal ultrasound scan test. Yes, all of you are aware. In all the EMD WhatsApp groups, my recommendation as a woman is go for pelvic ultrasound, abdominal ultrasound scan test. Thereafter, share the result of all the result to me privately. So ultrasound is the most commonly used scan for fibroids. It uses sound waves to diagnose fibroids and involves frequencies much higher than what you can hear. A doctor or a technician places an ultrasound probe on the abdomen or inside the vagina to help scan the uterus and ovaries. It is quick, simple, and generally accurate. However, it relies on the experience and skill of the doctor or technician to produce good results. Ladies, women, take note of this. It relies on the experience and skill of the doctor or technician to produce good results. Because oftentimes you see that this pelvic abdominal ultrasound scan test does not give us the exact test result, meaning that the doctor or technician did not carry out a good medical laboratory job or test on you. Because I personally have had experiences whereby a woman that have gone to see a technician, a doctor for pelvic abdominal ultrasound scan test, and the result will be showing that this woman is having fibroid. And this same test result will be showing the sizes of the fibroid. Lo and behold, many times with that number, when I carry out my own ultrasound pelvic test, the result will show the opposite. It has happened many times with that number. You know why? Yes, I don't know for other countries, but here in Nigeria, most of the laboratories are using fake and expired, not up-to-date laboratory equipment. That is the reason. No wonder whoever that consults Dr. Britishman, you're coming with test result as long as Lagos, Nigeria is concerned, or this country is concerned, and it's not from Mekio at Oshodi, I will turn you back. I won't accept that test result. I don't mind how much you spend. I will refer you to Mekio, because Mekio has the latest laboratory updated medical equipment. And when that result are carried out, it will give you the exact test result of your present health issue. That is the truth. So take note so that when you're going for this diagnosis, you know who the technician and doctor you're going to meet. Because here says it relies on the experience and skill of the doctor or technician to produce good results. Other tests such as MRI may be better for other conditions such as adenomyosis. All right. Let me just shed little light on this adenomyosis. Adenomyosis is a medical condition where the tissue that normally lines the inside of the uterus, which is the womb, grows into a thick outer muscle wall. Because oftentimes, this adenomyosis, oftentimes it is mistaken to be fibroid. You see now, which is not. So MRI scan test will show us if it is fibroid or adenomyosis. It's not the same thing. It's not the same thing. Take note of that, please. Okay? So, MRI, this imaging test uses magnets and radio waves to produce images. It allows your healthcare provider to gain a roadmap of the size, number, and location of the fibroids. Personally, MRI is the best to know the status of your fibroid if you have the means. MRI, because the MRI imaging test result will show the size, the number of fibroids, the size of the fibroid, the number of fibroids, and the location of the fibroid, whether it's inside or outside or in the wall of your womb. This MRI imaging test result will show us that. All right. He can also distinguish between fibroids and adenomyosis, which I said earlier. Yes, this MRI imaging test will also show whether actually you're having fibroid or, better still, you are having adenomyosis, which is not the same thing. So, how are uterine fibroids treated? Since most fibroids stop growing and may even shrink as women approach menopause, your doctor might initially recommend observation. That is, your doctor will begin to observe you for some time. You understand? Yes, begin to observe you for some time. However, some fibroids might require more active medical treatment, all depending on the following health fibroid conditions. What are those following health fibroid conditions? 1, extent of symptoms. 2, your age. 3, your fertility goals. 4, number and size of the fibroids. 5, any previous fibroid treatment. 6, other health conditions present. What are the complications of uterine fibroids? It is uncommon for fibroids to cause severe health consequences. However, women can have heavy bleeding that can lead to dangerous anemia or lack of red blood cells. Rarely, large fibroids can press on the bladder and the channel, that is the ureter, that sends urine there from the kidney. This pressure can lead to kidney damage or chronic kidney disease, CKD. Other complications include infertility and repeated pregnancy loss or miscarriages. These are the complications of uterine fibroid in women. So, that having been said, ladies and gentlemen, what do we have in Ever Healthy Multidynamic International to cure all the 3 types of fibroid, regardless of their size, regardless of their number, regardless of where they are situated in your uterus or womb? Does EMD have what it takes to cure fibroid completely? Because like I said earlier, most doctors will recommend surgery. I don't subscribe for that. Dr. Britishman can never subscribe for surgery. And I want to tell you why I don't subscribe for surgery. You see, like I said at the onset, every woman has fibroid. It is deeply rooted in your womb. If you go for surgery, what the doctor have done when carrying out this surgery of the fibroid is that he has just done surgery on the enlarged fibroid or the multiple fibroids. If I may ask, ladies and gentlemen, can you run away from your shadow? The answer is no. It's not possible for you to run away from your shadow. What am I saying? It's just like a tree that the roots are deep inside the ground. When you chop this tree to the stalk, after some time, what will happen? Rain will fall. What will happen after this root and the stalk in this tree? Rain beats it. What will happen? It will begin to sprout again. Not just sprouting, it begin to have what? Multiple branches. The same thing is applicable to fibroid. After surgery, the root of the fibroid is deep-rooted in your womb, in your uterus. Doctor will not remove it during surgery. Doctor can only remove it if you want to evacuate everything that has to do with your gynecological system as a woman. And no sane woman will go for that. Yes. So after surgery, what happens? After some months, maybe 2-3 months, the symptoms are coming back again because these fibroids are beginning to sprout again, grow. This time now, multiple. You begin to have branches. Yes. Spread in your womb. Yes. It's going to grow. The root is still there. That is why Dr. Britishman does not subscribe for fibroid surgery. Ask any woman, any lady who have gone for fibroid surgery. They will tell you that after 3 months, the experience was something else, was so discomforting, was so painful, even more than the first. They will tell you. They will tell you their side experience. That, in fact, they will share with you their regret of going for fibroid surgery because it's not the solution. It's not the way out. I don't subscribe for surgery. It's not the way out. It's already there. It is part and parcel of you as a woman. It's going to grow. When it grows, it will sprout now in multiple forms with lots of health complications. Because now there will be multiple. It will have branches, different sizes. So why go for surgery? Why opt for surgery? I remember when a couple, I was consulted all the way from Ghana. Somebody gave them my contact. They left Ghana, where they came from, to Lagos, Nigeria, came to EMD head office to see me. That they got my contact and they said they should see me, they should consult me. They traveled all the way from Ghana to Nigeria. In fact, the day this couple came, the wife of this man was crying with excruciating pain. She couldn't walk erect while climbing the staircase. Even in my medical office, this woman was still experiencing excruciating pain. And they dropped all their test results they've done. And the woman has already been booked for surgery. And I told the husband, well, you're a free moral agent. You have the final say as a husband. She's your wife. But for me, since you came for me, if you allow me to take decision, I will say your wife should not go for this surgery. And I told him the side effects, the complications that will come there after the surgery. The man had confidence in me. He said I should proceed and recommend EMD Ayurvedic curative medicines, which I did. This woman is in pain. You know, when a woman is about to give birth pain, that was the kind of pain she was experiencing. In my office, she couldn't sit down. And after recommending EMD Indian Ayurvedic curative medicines, that was on a Friday. This man, from that Friday night, this man kept calling me, even at odd hours, putting the phone on the wife's mouth for me to hear that the wife is screaming, shouting. Even at a point, the man was saying, Dr. Britishman interferes, I'll finally take her to the hospital for the surgery. This pain is too much. I can't take it anymore. I said, please be patient. I know what I gave to your wife. It is EMD Indian Ayurvedic curative medicines, second to none, first of its kind. Saturday, this man kept calling from morning till night. Sunday, lo and behold, I said, let her continue to take these medicines religiously and avoid food I said she should not eat. And eat what I said she should eat. Ladies and gentlemen, to cut the story short, on Sunday, between 3 to 4 p.m., this woman said she wants to go to toilet. The husband, the one that was screaming, shouting, she quickly rushed to the restroom. As she sat on the WC, lo and behold, she said, defecating the fibroid, one after the other. After a week, they came back to Dr. Britishman's office. Now, not with pain, not with cry, not with agony, but this time around, with smile, joy, laughter, and the likes. And they said they came to appreciate me. I said, no problem. You go thank your God. EMD, Indian Ayurvedic medicine, first of its kind. The efficacy is second to none. I'm happy, madam, that you're smiling now, you're laughing, you know. So
Entendo.
So what do we have? You can see on the screen what we have. No matter the type of fibroid, we have 3 types. No matter the type, you can see on the screen. Number 1 is EMD clean detox. EMD clean detox. This is not all. This is not all. EMD clean detox. This is not all, please. EMD clean detox. Can the clean detox be shared on the screen? Can it be shared? My moderator, can you share clean detox for this lovely audience to see EMD clean detox? Our EMD clean detox serves as antioxidants. It's a detoxifier. It detoxifies you from the crown of your head to the sole of your foot. That is one of the Indian Ayurvedic medicines a woman should take when you are having uterine fibroids, or when you're having fibroid, no matter the type. We have 3 types, like we mentioned earlier. Clean detox. Can the clean detox be shared on the screen so that this lovely audience will see it? Can it be shared? Is it possible, my moderator? I want the clean detox to be shared.
Not possible to play.
So,
Nous,
in
nous
addition
sommes les
to,
francophones, on ne vous entend pas. Hein?
in
On ne
addition to
comprend pas
clean
ce que vous
detox,
dites là.
please mute
Ciel.
yourself, please. Mute yourself. We're hearing you. Mute yourself, please. So, clean detox, number 1. Number 2, EMD green tea. I can see EMD green tea there. The green tea is there. That is another EMD Ayurvedic curative medicine. If you're handling health issue of fibroid, clean detox, EMD green tea. Okay, the green tea is there because no matter the size of the fibroid, like we learned this today, the size ranges from the size of a pear to the size of a watermelon. So regardless of the size, regardless of how many they are, this green tea will really bring them, shrink them, bring them to, pieces them, you begin to defecate them. That is why the green tea is there. The next is Vitatrace that works in the cellular level. Our double stem cell Vitatrace that works in the cellular level. All right. Then we have Habitus juice, a woman in a bottle. Habitus juice. When you're handling health issues of fibroid, Habitus juice must be there, a woman in a bottle. All right. Then you have Utritone. Utritone, another great remedy, curative medicine, courtesy of Ever Healthy Multidynamic International. Then we have Kabul 500. In India, Kabul 500 is called the Tree of Life. Yes, in India, it is called the Tree of Life, Kabul 500. Then we have Iba juice. I've taught you all before now that Iba juice works holistically. Any health challenge, Iba juice must be there, you're handling. Make sure that Iba juice is there. Is it diabetes? Is it high blood pressure? Is it kidney issue? Is it liver? Is it fibroid? Is it infertility? Is it typhoid? Is it malaria? Is it high blood pressure? Is it prostate? Is it fibroid we're discussing now? Iba juice must be there. Then finally, the last but not the least, noni juice. You can see noni juice on the screen. So ladies and gentlemen, these are the 7 or rather 8 EMD Indian Ayurvedic curative medicines we are going to use for these 3 types of fibroid so that we can get and have an effective curative result. So at the end of the day, these women, these ladies that are having these fibroid health issues will come back to you with joy, appreciation, and thankfulness. All right. So, like I do say, at any point in time, whatever the health issue, could not be fibroid, it could be diabetes, any health, always consult Dr. Britishman, the company's doctor, so that I can guide you medically on the prescription and dosages. Remember, I do also educate you all. It's not all about giving this Indian, ever healthy Indian Ayurvedic curative medicines in the hands of your client, in the hands of the end users. No. Also make it a product of your product. Make it a product of your product. And again, make sure you educate your clients on dieting, nutrition, lifestyle, very important. I do educate you all on that from time to time. It's not just handing this medicine to them, also carry me along so that we tell this client or this patient what to eat and what not to eat while using this ever healthy Indian Ayurvedic curative medicines. Ladies and gentlemen, I want to draw the curtain close at this juncture. Thank you for being present, and I believe you've learned a lot today as I want to hand over the mic to Mama of Africa EMD, Madam Gladys, for question time. Welcome once again.